Greetings. I am Dr. Tammy Lee Demler. I am the Residency Program Director for both the PGY1 and PGY2 Psychiatric Residency programs at the University of Buffalo School of Pharmacy and Pharmaceutical Sciences, which is actually at the Buffalo Psychiatric Center, which is a facility of the New York State Office of Mental Health. We have two programs. We initially started out with our PGY1 in 2005 and subsequently ended up getting accreditation for a PGY2 in specialty practice for psychiatry in 2009. And we've been rolling with great candidates and alum ever since. Our program, while it's administered through the University of Buffalo, you're actually an employee of the New York State Office of Mental Health. So that collaboration has been in place for a number of years, and it works really nicely for us all. It is in downtown Buffalo, which is a very vibrant location. So for those of you considering relocating for a residency position, you have to always be thinking of location, and we have so much to offer here in Buffalo, New York. I would totally encourage you to pursue looking at that as not only an opportunity to learn, but to experience a new part of the area in the country. Our program details are such that our program's purpose for the PGY1 program is that it builds on the Doctor of Pharmacy education. Your initial degree and outcomes contribute to the development of clinical pharmacists who are responsible for medication-related care of patients and with a wide range of comorbidities. You're eligible for board certification, and that's what we plan on trying to help educate you through and to train you to become prepared for, so that you're also potentially eligible if you're interested in the PGY2 program. Now, we're going to spare a little time so that my current resident can speak to you as to why she chose our program. But one of, I think, the nice foundational pieces of our program is if you choose to move on to specialty practice, you can move right in. We are all on board for early commitment if it's a good fit for both of us. The strengths of our program include the collaboration, both inpatient and outpatient, and also the teaching philosophy. You're going to be, as a graduate, a resident that's competent, compassionate, and effective, dealing with people with not only mental illness, but with a wide range of comorbid illnesses. You'll be skilled in providing education to patients and caregivers and students and healthcare providers. And our opportunities for learning experiences are very customizable. And I think that for myself as a program director who is very involved on a day-to-day basis with my resident daily, I will say Dr. O'Donnell will be telling you, is a really great opportunity for mentoring and being able to prepare you for not only a clinical path, but also an academic path as well. Our facility, as I mentioned before, is in Buffalo, New York. It's a psychiatric hospital, but if you're looking for a PGY1 with just general comorbidities, you're going to get them because our patients are unfortunately very medically ill as well. It's a 160-bed Joint Commission accredited facility. But in addition to the inpatients, we have thousands of outpatients that are in constant need of care, and our opportunities for learning experiences will encompass both of those. While it's a psychiatric hospital, we do have off-site rotations with some of our very, very skilled faculty at the University of Buffalo that will take you through a journey of general medicine. We have pediatric focus. We also have a geriatric rotation for which I'm board certified in geriatrics, but we have a pharmacist medical specialist who's both a doctor and pharmacist who is also part of that collaborative role. So elective rotations upon request, customizable circumstances always, and we're looking at your growth as a professional on a quarterly basis with a great deal of intensity and robust oversight. I won't get into this too much because I know we're limited for time, but certainly feel free to reach out to me if you have any questions relative to any of these experiences. The clinical pharmacy services is a progressive development of your capabilities over time. You start out first of all with orientation. The building blocks of these activities will help you become more confident and competent in clinical pharmacy services. Practice management, also longitudinal. It's broken into two sections over time, 6 months each, which I think is really a blessing in disguise because your projects are really longitudinal. Helps you with P&T committee projects, MUEs, oversight of quality management. You would be surprised how much that becomes part of what you do on a daily basis as a pharmacist. So we teach you how to do that. I have this skill in management. I have an MBA, and I like to bring in some of that training as well for those of you who have interest in management. Teaching and education is the core foundation for all of our UB programs. We have a teaching certificate whereby you learn to teach. Teaching is not something you just happen to become good at. You need to be learning how to do it the proper way. So our teaching and education will help you use those skills, applying them in educational endeavors, didactic teaching, precepting on site, and doing full service CE programs to our pharmacists in the community. I touched on general medicine, which is actually situated at an acute care hospital affiliated with ours. Again, faculty of University of Buffalo would be your teachers there. Pediatric and geriatric specialty rotations are a core recommendation and requirement for PGY1, but based on your PGY2 interest for psychiatry, that's based on your own preference. So we, again, customize all of these things for you. And research and project, I'll just say that we always have tons of research projects on the table. We try to give you the opportunity to pick one that you'd like. But one of the, I think the benefits for our philosophy is that you walk right in with an IRB already completed and ready to go based on our current residents' work for IRB. You write the IRB in the second part of the year so that you're used to what you need to do and that you're feeling less stress in terms of time. Eligibility and how to join our team, right here, please review it. Certainly touch base with us. Our application deadline, January 8th. Our matching position and code services are there. For those interested in pursuing a PGY2, certainly early commitment is something that we are always looking to entertain. And this program purpose is really, again, building on that Doctor of Pharmacy education that you have in that PGY1 foundational learning that you completed. Again, opportunities to function independently, accumulating knowledge and experience, and being able to become that professional specialist that you want to be. Again, customizing what your experience is and what you want it to become part of and what you want to do as your future goals. Again, what it required experiences, we have adult outpatient, adult inpatient, university services and education. We do have research and project that continues. Administration, which takes on a little bit more robust meaning in a PGY2 specialty, and offsite specialty rotations that are neurology. For purposes of specialties PGY2, you need to be able to practice and be able to pass the BCPP. So we ensure that you've seen everything you need to as best as we can so that you're prepared to do that. Eligibility, similar circumstances here, application deadlines, my contact information, and certainly you can look us up on the University of Buffalo for residency programs. And with that, I'm going to pass the baton over to my resident, Dr. O'Donnell, who will just briefly tell you why she chose us.
Hello, my name is Dr. Carolyn O'Donnell, and I'm the current PGY1 resident at Buffalo Psychiatric Center. In the first couple months of my residency, I have really loved everything that I've done through this program. This residency stood out to me for a lot of different reasons, the first one being opportunity. As the only resident, you have the ability to explore your passions and really take on projects based on your interest. You have a lot of regular meetings with your preceptor, and the mentorship that you get through this program is really amazing. You also feel part of a pharmacy family. We have a lot of fun at our facility. We do things like celebrate birthdays, holidays, even crafting during the lunch hour, so it's a really enjoyable place to work. This is also a unique residency because you get a chance to learn more about psychiatric pharmacy during your first year residency, and then you have the opportunity to apply for a PGY2 in psychiatric pharmacy. So there's that benefit that goes along with it, and I have really loved all of my experiences so far, and I highly recommend this program overall.
Thank you, Dr. O'Donnell, and I'm happy to just say that a lot of the preceptors you'll run into are past alum that we were able to retain as clinical pharmacists. And I want to just wish you good luck on all of your residency endeavors, and we are thankful that you considered us.